Pedophilia is defined as a psychiatric disorder in which an adult is primarily or exclusively sexually attracted to children 13 or younger. How prevalent is this? How often does it lead to a crime? And can someone with this primary attraction get help and change? Welcome to Insights. I'm Dick Goldberg, and with us is Dr. Fred Berlin. Dr. Berlin, a psychiatrist, is the founder and the director of the Johns Hopkins Sexual Disorder Clinic. That clinic specializes in the evaluation and treatment of patients with sexual disorders, including pedophilia. He's also authored several journal articles on today's subject. Dr. Berlin, thanks for joining us.
Thank you for having me. I appreciate that.
So, Dr. Berlin, is my opening definition fairly accurate and close to what a pedophilia is?
Yes, it refers to a situation in which a person's sexual orientation is directed either in whole or in part towards prepubescent children.
How common is this? How many people fit this description?
Well, we really don't know, and one of the reasons we don't know is that people who experience these attractions are understandably very fearful and frightened about others finding that out. It would be important to gather that data, but at the present time, for obvious reasons, it's very difficult to gather that information.
Well, if you had a guess, do you think it's under 1% of the population?
If I had to guess, it's probably under 1% of the population. On the other hand, when you look at the numbers that would involve, those are still very significant numbers, and when you look at the number of children who potentially could be at risk as a consequence of that, it's still a cause for serious concern.
Are we talking about 100% men who have this?
No, not 100%. There are many psychiatric conditions that break down along gender lines. Anorexia nervosa, for example, mostly affects females, but we occasionally see males. Similarly, the paraphilias, the various sexual disorders, predominantly affect males, but we do still nevertheless sometimes see females with these conditions as well.
Is it all the same when we say pedophilia? I don't even know the noun for a person. What do you call a person who experiences this? A what?
Well, again, it's very important that psychiatric labels not be used to label human beings. In other words, any diagnosis is just a shorthand way of conveying information. And so if I, as a physician, say that I've diagnosed with someone with pedophilia, it tells me that they are experiencing sexual attractions to prepubescent children. We want to be certain that they don't act on those attractions. If they need help, we want to assist them. But that's not to label the person as though somehow they should be demeaned or stigmatized. And again, there are many people who experience these attractions who aren't acting on them and yet feel demonized and afraid to discuss the issue because of the way in which society tends to view everybody with this condition at this particular point in time.
Are there different types of pedophilia disorders where you're attracted in different ways, or it's stronger, or different ways of differentiating this?
Sure. I mean, it's like asking, are there differences amongst people who are heterosexual? There's tremendous diversification there. It's just that what they share in common is that they're attracted to adults of the opposite gender. With pedophilia, we can talk about individuals who are attracted to the same gender, to the opposite gender, sometimes to both. We can talk about whether they're exclusively attracted to children or whether they do have some degree of attraction to adults, but in addition to that are much more drawn to children than are the rest of us. So there are many variants when it comes to this particular condition.
Why do people have this condition? Is it genetic? Are they born with it?
Well, listen, why am I attracted to women? Why are some of my friends attracted to members of the same gender? What we know it isn't due to is some sort of voluntary choice. And in other words, when I was a little boy, I didn't sit down and say, look, you've got some decisions to make. You want to grow up to be attracted to women or to men or to boys or to girls. And growing up, we all discover who it is we're attracted to. And for those who in growing up discover they're attracted to children, I can tell you, having worked with many of these people for a long time, it's a very alarming discovery to make. And in our society, most of these kids, and they often realize this by the time they're in their later teen years, are terrified to discuss this with anyone, even a counselor.
And are they afraid they're going to get in trouble or just be frowned
upon? Yeah, they are, and that's true even if they haven't acted. They know there are mandatory reporting laws. They're not often sure exactly what they may be. So, and they hear all the time. I mean, you can't turn on a crime show on television without hearing the way in which the term pedophilia, psychiatric diagnosis, is used in a way to say that someone's less than human. So they pick up on all of this, and they're terrified to have others know about their attractions. Now, as I said, they're not that way because they've decided to have these attractions. They do have a responsibility not to act upon them. But as with drug addiction, alcoholism, other behaviors that are driven by powerful biological forces, some of them, at least, may need some help to be able to maintain proper control. And yet, as a society, we do very little to reach out to these people before they've acted, encouraging them to come forward and to get that professional assistance.
I'm sure you remember when being gay was a psychiatric disorder, and then when that was changed to not being a psychiatric disorder, and when there were treatments way back when for people who were gay to help them be heterosexual. Is there any similarities here with pedophilia?
Well, there are. And first of all, we shouldn't pretend that value judgments don't play a role in how we might see whether or not a particular condition is or isn't a disorder. For example, I don't think it's the business of the medical profession or of government to get into the privacy of the bedroom when two consenting adults are engaging in intimate behaviors that are not dangerous. And so I don't think that in terms of my values that it's any of my business if two men or two women want in a consenting way to be intimate with one another. I do think we as a society have a right to protect children, and so it's no more somebody's fault that they're attracted to children than that they're attracted to adults. They just discover that these are the sorts of attractions they have, but I do think as a society we have a right to say to them, and that they need to understand that children are not miniature adults, and as difficult as it may be, we need to make sure that you don't act in a way that's going to cause a child to be harmed. But we can do that with a sense of compassion and understanding and recognizing that these are human beings who are struggling rather than simply demonizing all of them and driving the problem underground.
The people you treat, how many of them are there because they want to be, it's voluntary, versus they've gotten in trouble?
Well, that's an interesting history. We actually published on this. Years ago, before the mandatory reporting law went into effect requiring doctors to report adults who sought treatment on their own, over a period of several years, we had, I believe it was 73 people who came in entirely on their own, not having been apprehended and wanting help. Once the law changed, we had to tell people that if you tell us something that's reportable, we're going to report it. And of course, there's not a defense lawyer in the world that would advise someone to self-incriminate and put themselves in jeopardy of going to prison for many years. So the answer to your question is now with the mandatory reporting statute, virtually nobody comes in on their own. They call up, they ask whether they can be seen, and when we tell them we'd have to report them, they don't identify themselves and they don't come forward. So one of the ironies here is that a law that was intended to protect children, it's done a lot of good in many ways, is also deterring undetected people from coming forward and getting the very help that might make the community safer. Now, to not leave the sense that the only reason why people come is because they have to, in this day and age, most of the people do come in because they're in some sort of difficulty, but
legal difficulty.
Yeah, legal difficulty, and so they may enter treatment, for example, as a condition of parole or probation. But to not leave people with a sense that that's the only reason they're here, although the overwhelming majority come in that fashion, there's still a huge percentage that continue on in treatment long beyond any point where parole or probation would mandate them to do so. And so the point is, if we can get these folks into treatment, many of them are then motivated on their own without having to have any sort of a club over their head to continue that treatment. It's not easy to live in society having to lead a double life, having to privately know that you've got attractions you can't talk to anybody about. And when folks get into treatment, I don't want to candy coat, not all of them, but most of them, when they get into treatment, appreciate that there is help available, that they can begin to live productive and safe lives to feel good about themselves, and the majority are appreciative of that opportunity. And we've published some recidivism data showing that the overwhelming majority of people who've been in treatment do not continue to pose a future risk to children in the community.
Now, this must-report law, let's say someone comes in, they have not committed any crime, but they do have this attraction, they want some help controlling their behavior. Do you have to report them?
No, we don't, but again, many of them are not clear on that. There's actually a project in Germany now called I think translated the Darkfield Project, really referring to the fact how so much of this is driven underground. And they're doing something I think is terribly important. They're advertising in the media. They're encouraging people to come forward. I put it to you that in this country, we often hear an advertisement that if you have depression, if you have a drug problem, if you have anorexia, whatever, for goodness sakes, come in. We want to help you. When's the last time we ever heard a public service announcement in this country saying if you're a troubled 17-year-old, if you're privately aware of being attracted to much younger children, if you're worried that you're having sexual feelings you might not be able to control, for goodness sakes, please come in before you hurt others and ruin your own life in the process. We do virtually nothing in this community or in this society to try to deal with this problem before the fact, and then we end up having tragedy to pick up the pieces after someone has acted on these attractions.
So there must be some people who now know clearly you won't report them if they've done nothing illegal, who do come in for help, just a lot
more
numbers.
Yeah, as I said, I didn't want to overstate that. Unfortunately, they're the minority. I don't think that enough is being done to encourage them. And I don't want to suggest that everybody who has these attractions is necessarily going to do the right thing, but I certainly believe a lot more of them would if we as a society would stop driving the problem underground.
When people come to you voluntarily, how often do they come and say, I don't want to be attracted to children? Help me not be attracted.
Again, they don't usually use those words, but there was, for example, an anonymous survey done recently, because when people can be surveyed in this way over the internet, they're not necessarily so fearful and can often speak more candidly. And there were just some very touching examples of people talking about how troubled they were about the fact they have these attractions, how they don't want to hurt children, how they're terrified, though, if somebody knows that they'll be ostracized from their community, they'll lose their friends, how they are afraid that they might be reported because they're not clear on the conditions under which that might happen, that they fear if they go to a counselor that they will be turned in rather than assisted. So I don't want to pretend I have more numbers than I actually do. As I said earlier in our interview, it'd be important to get some of this information. But there's plenty of people out there that are very troubled and tortured by the fact they experience these attractions, that they don't want to act on them, they want to do the right thing, and yet they're just terrified of what society would do to them and how they'd be ostracized and lose friends and so on if others knew about their situation.
I still think it's useful to deal with this question of, is it changeable, or is it it's so in your DNA that the question is, how do you cope with it? Don't expect to change your attraction.
Yeah, it's a very fair question. It's not curable, which is not to say it can't be successfully treated. I'll make an analogy to drug addiction and alcoholism. We don't yet have the cure for those conditions, although I think with future research someday we will. But that doesn't mean that in the meantime we can't help people learn how to resist giving in to powerful cravings and to control themselves and to live safe and productive lives. So it's the same situation here. If someone's sexually attracted to children, I don't have the cure that would erase those attractions, but I do have techniques that I can teach them about how to successfully resist succumbing to these kinds of cravings or urges. And beyond that, I do have medication that in some cases, if necessary, will very much lower the intensity of their cravings. It can act in effect as a sexual appetite suppressant, the idea being, to put it in layman's terms, and if I'm hungering sexy for children and the doctors can make me a lot less hungry and I'm trying to resist temptation, it'll be a lot easier for me to do so. And there's some very good evidence that when sex drive lowering medication is provided to folks who are having these difficulties, that there are very low rates of recidivism, and that is a way of increasing the ability of such an individual to maintain consistent self-control.
How many people, again, you don't have the data, but do a lot of these people also have normal partnered lives, marriage, or partnered up?
Well, I mentioned earlier that one form of pedophilia is the non-exclusive type. In other words, that's an individual who not only experiences strong attractions to children and therefore has to be careful not to act upon them, but is capable of adult intimacy as well. They do find adults to be, to some extent at least, a source of to be sexually attractive. So it's easier in those cases to help those individuals learn how to channel their sexual needs in an appropriate way. But again, I don't want to overstate how and make it seem simpler than it is. It's kind of like the man who's married and has very strong attractions to other men. He may have some degree of attraction to his wife, but he may still be struggling over time not to give in to the urge to be with a male partner. And so these are challenging issues, that they're struggles that human beings are coping with. When I treat people, I always have to remember we're doing it in the context of needing to be sure that we're cognizant of legitimate concerns about community safety. But these problems can be successfully treated, even though they can't be cured. And contrary to common public misperception, the overwhelming majority of people, certainly that we've had in treatment over the years, have gone on to lead safe and productive lives. This notion that once a sex offender, always a sex offender, seems to be out there, and it's very, very far from the truth.
Now, you talked about people who have attractions both to opposite sex and children. What if their attraction is exclusively to children?
Well, that obviously makes it much more difficult, and that's where we would be thinking far more about the likelihood of needing to use medication to lower the intensity of their drive. And again, it's a sad situation, but the reality is that when you're hungry and you can't eat, you're very frustrated and miss it. If you're not hungry, you don't necessarily miss the fact that you're not able to eat. So it's kind of analogous here. You think that if we, how does someone go through life not really wanting and missing sex? But for some of these people, they understand that, there's two ways I'm not going to have sex with children. One is I'll be in jail and I can't have it, or the other is I'll accept treatment and still be able to have a life for myself. And so if we give them medicine where they're not having strong desires for sex with children, it's not as frustrating as one might assume, and then they can still have lives. Now, are these lives that are in some way compromised? They are, and that's one tragic thing as a physician that we often see. People have various sorts of conditions, and they can't lead quite the same lives that they would otherwise lead, and that's very tragic. But many people can still have a good life for themselves and feel a sense of satisfaction and that it's meaningful and productive. So it's a shame in a sense that these people might need to give up on that kind of sexual intimacy, but if we can help them to do that and still have a meaningful and satisfying life, that's still something that we can and they can feel pretty decent about.
If they do get married and have children, is there a risk of their attraction to their own children?
There is. Again, someone with the exclusive form of pedophilia is not likely to fall in love and to be intimate with an adult. In fact, many of them are not even able to perform with an adult. But part of therapy is sort of educating people on what circumstances are reasonable, what changes in lifestyle are going to be necessary. And again, some of this has to be on a kind of a case-by-case basis. But certainly one has to be particularly cautious if one is attracted to children about having children of their own, about the fact that children are going to have playmates. Now, that said, and that is the first rule, is to be extremely cautious to make sure children aren't being endangered. There are lots of people who are married who've had these attractions, sometimes even who've acted on them, who never again act on them, turn out to be good parents and lead good lives. So I don't want to just fall into stereotyping as though everybody is needing to be dealt with that same broad brush. That simply is not true.
Maybe this would help us understand your work. Let's say you are treating someone who did or did not offend, but they're married and they find themselves attracted to their own children and their children's friends, and they're scared. Besides a drug to lower their sex drive, is there any other treatment you can offer?
Sure. We would want to make sure that they're discussing that with their spouse, for example. Or the family may not be part of the problem, but they can be part of the solution. The spouse can help to make sure, because she's now knowledgeable, that the children aren't inadvertently put into situations with this individual that might be situations that he's not going to be able to handle appropriately. So just developing an appropriate support system, making sure people understand, and instructing individuals about how they need to avoid being in situations of temptations that they may not be able to handle. I mean, again, it's much like talking about an alcoholic, that they shouldn't be keeping alcohol in the home. They shouldn't be going out with others and drinking in bars. And if they follow certain rules and discipline themselves, and others who know about it or assisting them, in many cases they can be quite successful. It's a very analogous situation to this one. Now again, many individuals who are attracted to little girls, they're not going to be a threat if their children are are boys. These are all the parameters that need to be discussed and explored in trying to assist people with these issues.
What kind of things are we talking about behaviorally? Are you talking about making sure you're never alone with your child's friend, or
yes,
like that?
Again, if there's a sense that child would be at risk. Now, again, you have to have some sense of what age of vulnerability. That people aren't necessarily attracted to children across the whole spectrum of ages. That they may be people who are attracted only as children become into their teenage years, and may not pose much of a threat to prepubescent children, or in some cases it might be just the opposite. So it's a matter of really understanding the nature of the problem and helping people to deal with it based on the reality of their particular circumstances.
Well, at the risk of sounding provocative, people who are alcoholics often slide back, and progress might be they're sober for periods of time. Some people just never drink again.
Right.
This is scary, what you're saying to me, a little, because it might mean a person might slip.
Well, all of this is scary, but again, we have to look at the reality of what solutions we might have. For example, if the only thing we want to do with someone who's sexually attracted to children is send them to prison, there's nothing about prison alone that either erases their attraction or enhances their ability to deal successfully with them, and sooner or later, like it or not, most of these people are back out in the community. Again, if we're just going to send everyone to prison, we drive the problem deeper underground. If we continue to stigmatize, we don't encourage people to come forward. So I don't want to overstate the case. There are not simple solutions to this, and the problem is that people sometimes think there are, and I think that just puts things back further. Having said that, and it is scary, I can assure you that the overwhelming majority of people who have been in treatment do well. Is somebody going to say, can we give an absolute guarantee that everyone will do well? Of course we can, as much as we wish we could. And sometimes, I guess, in society, it comes down to, where you draw the line. If somebody is a drunk driver and we give them another chance and they never hurt anybody else, the family of that drunk driver says, thank God we have a compassionate society that gave them another chance. If we give that same driver another chance and God forbid he kills a child of another family, we ask why did society not just throw away the key on every drunk driver? So it's a judgment call, and these are all extremely difficult issues. But I think that's what I would hope people would understand, that it's not just so simple as these are bad guys, we'll lock them all up and we can legislate or punish the problem away. I think we have to have a much more thoughtful discussion, and hopefully that's what we're going to stimulate through our conversation here today.
Well, the justice system and how they handle this, one of the things I wonder about is pornography. It would seem to me, if this is someone's exclusive sexual attraction, it'd be pretty tempting to, since you don't want to hurt a child, to get your outlet by viewing pornography. And yet if you do the crime, you go to prison.
Yeah, well, again, it's a complicated issue, and one of the things we have to find out in working with people is viewing pornography going to, in a sense, whet your appetite and maybe make you more likely to act, in which case we don't want that individual to look at it. But there are other people where they can look at pornography, decrease their sexual urges, and it makes it much easier for them to be in control. And that would be an example where we might want to look at that in a somewhat different fashion. Now, obviously, we cannot allow children to be exploited in the production of child pornography, but there are things such as virtual pornography out there now, and if in a given case that was going to make an individual safer, as distasteful as that discussion may be to some, and I understand the emotion that's tied to that, it still might be a conversation worth having, because the bottom line here is every one of us want to protect children and keep society safe. There's no two sides when it comes to that issue.
I never thought of this. So define virtual pornography.
Well, it's pornography that is produced by the use of a computer, and the technology is so good these days that you can do it in a way that looks quite realistic. Now, as I said, I want to be very tempered here. There may be people for whom that can actually increase their drives and not be a good idea. But if there's a subgroup of people where looking at that pornography diffuses their sexual tensions, releases sexual pressures, makes them safer, as I said, I understand the emotion tied to that. It's a very disturbing thing to talk about. But if it makes children safer, is it not a conversation that is least worth having?
Yeah, and right now, if a person does view virtual pornography of children, is that an offense that can send you to jail? person?
Again, I'm not an attorney. I'm not certain about
you don't
that.
Have one nearby.
So I don't want to answer a question that I'm not confident about the answer.
Yeah, but that's very interesting. When you look at the criminal justice system, do you have anything you'd like to share about how it's working with pedophiles?
Well, I just think that we need to have a model that's closer to what we do with drug addiction and alcoholism. That we absolutely need to have a strong criminal justice component, but we also have to not just give lip service to the idea of research and treatment. And I mentioned earlier, we seem to think in our society that we can completely solve this problem by punishing away or legislating away. I mean, imagine if the only thing we did with dangerous drug drivers was put them on a registry or send them for prison for as long as we could and did nothing more. We'd be doing a tremendous disservice to the community. And so I certainly support the importance of a strong criminal justice component here. But at present, I think we just give lip service to the mental health side of it. I mentioned that we do virtually nothing to provide public service announcements to encourage people who are having these attractions to get help before the fact. We don't leave them with a sense that society would welcome the idea of them coming forward in that way. We just have so stigmatized and demonized anyone that experiences these attractions that they are meant to, that they feel less than human. We tend to see them as less than human, and I think neglecting that aspect of it, neglecting the public health side of it, not having clinics available to which these people can come for treatment, in some cases before they cross the line, that's where I think that we as a society are not only failing them, but failing ourselves as well.
So this should be available through insurance companies or whatever, and be
there should
acceptable.
There's Betty Ford clinics for people who have an alcohol problem. They don't have to wait until they're drunk drivers. Where are the Betty Ford clinics for these? You know, as we speak, there's a number of 17-year-old kids out there that are very troubled and privately knowing that they're not attracted to other 17-year-olds, but they're recurrently attracted to 8 or 9-year-olds. Where are the clinics that they can go to? Where's the education that they're being provided with? It's virtually non-existent.
Okay, if someone's listening to this interview and they're feeling what you're talking about, they're 17 or they're 23 or 30 and they're troubled by their sexual attraction to children, what can they do? They haven't committed a crime yet. What can they do?
Well, there's a program, and it's not available everywhere, but it's called Stop It Now. They have some helplines that they can call. If they get in touch with my office, I can let them know how to reach Stop It Now. They could certainly call my office, and we could try to provide them with some resources. So, and I do get letters and hear from people who are having exactly those sorts of difficulty. So I'm not suggesting it never occurs.
Well, Dr. Berlin, may I interrupt you so that give you an opportunity to tell people how to get in touch if they're listening to this rather than they're trying to find it, if you're willing. If you're willing,
well,
email
I can go ahead and give my email address. That's
please do.
Fred S. Berlin, MD at Comcast.net. Again, Fred S. Berlin, MD as a medical doctor at Comcast.net. Or they can also feel free to...
.net or .com? You said .com before, I think. It's a .com or
they can feel free to call my office if they would like and explain their situation. I wouldn't... I'd be glad to talk to them and see if I can help. That's 410-539-1661.
Was that .com or .net at the end of your...
It's .net.
.net, okay.
Yes, Fred S. MD at Comcast.net.
Okay. Are there any other things that we haven't covered that you think are important to discuss here before we close?
Oh gosh, well, I'm a teacher. I talk about this all the time. There's just so much that needs to be discussed here, I guess. I mean, it is important to understand that the term pedophilia is just conveying information about the kinds of sexual attractions a person experiences. It doesn't say anything about their character, their temperament, their personality. It doesn't say they do or don't have a sense of conscience and moral responsibility. It's also important to distinguish pedophilia from child molestation.
What is the difference there?
Well, just like not every drunk driver is an alcoholic, not everyone who has sex with a child has pedophilia. There are people who get involved, particularly with older adolescents who aren't doing it because there's something different about their sexual makeup. Some people get involved with children because they're high on drugs and disinhibited and impaired in their judgment. So there are many factors that might lead an adult to act improperly with a child, or in other ways that don't necessarily have anything to do with pedophilia. It's also the case that there are numbers of persons with pedophilia who don't act on those attractions and are quietly struggling and dealing with them. So again, any psychiatric diagnosis is just a shorthand way of conveying information. Pedophilia tells us that we're dealing with a human being who experiences a particular kind of sexual attraction, but it doesn't say they've acted on it. It doesn't say they're necessarily lacking a sense of concern for children. And I think those, as simple as that may sound, are issues that most people have not taken the time to think about.
You bring the subject up of sex offender registration. Is that worthy, if we ever have the time, of a whole other discussion, or is there some comments you'd like to just share with us on that?
Yeah, it probably is. I mean, there's very little evidence that it's helping. Now, keep in mind, police don't need public notification or registration. It's certainly a very good thing that the authorities have access to the prior criminal records of individuals, including those who've committed sex offenses. They can use that in investigating. If there's an unsolved crime, that may guide them in terms of a direction to go in. But something that most people don't appreciate is that better than 90% of all sex crimes committed in a given year are by people who've never before committed a sex offense. And so we're spending all this time and money and energy on a registry when the bulk of the problem has to do with people who aren't registered and who've never previously been identified. It gets in a little bit to some of the discussions we've had about trying to encourage people who might have these attractions to get help before they cross the line. So there are serious questions about whether the registry is accomplishing much that is useful. I do understand why people might want to have the sense of knowing that someone in their neighborhood has had a prior offense, but it then begs the question of how do they use that information in a way that's going to do something more than simply scare them? How can they use that in a way to make the community safer? Are we giving people guidance about those issues?
Right.
There's a lot of misinformation on the registry. There's been some vigilantism. So if you want to talk at some further point with me, or maybe someone who's even more knowledgeable about the registry, it might be an interesting topic.
It does sound like worthy of another program.
Yeah, it probably would be.
Well, Dr. Fred Berlin, I thank you very much. I think this has been a terrific introduction to the subject.
Well, thank you.
And I hope you'll join us on the next edition of Insights. And remember, you can find all our podcasts at dickgoldbergradio.com or search for Dick Goldberg at iTunes or YouTube.